Foundation is a Tanzanian NGO operating in Tanzania with thematic areas in health services, youth, livelihood, and climate environment issues. We are more focusing on creating an environment where everybody can get the quality service in a setting, supporting the initiative that the government has already put in place, the strategy that the government has already initiated. So we are complementing those initiatives by integrating some services into primary health care settings. We are doing that, supporting pregnant women through education, lifestyle, training, letting them know what they are supposed to know related to their situation until they give birth. And now when it comes to after birth, we are also providing the education and the necessary services, like when it comes to sickle cell, the screening for newborns. That's part of that as well. That's including the medications for maternal and child health. We are talking about oxytocin, we are talking about magnesium sulfate, calcium gluconate, all of these medications. So when we were doing that, we also went through the number, the birth rate in specific areas. We went through the mortality rate in certain areas. We went through all these kind of matters. Just how can we support the government initiatives in terms of supply chain, but to complement this other stuff. And when we kept on digging, going in, searching for why the children die, we realized there are conditions which are not addressed. The communities are not aware of it. The service providers have not yet been empowered, capacitated enough to understand them and to deal with them. So they were left untouched. And then sad enough is that the parents, the mothers and the fathers were not aware of certain reasons of children's death. So when we went to dig in, we found out that sickle cell is among the reasons why the children are not getting to age 5. They just end up before age 5. Why? Because no one was aware of sickle cell in the areas. Service providers were not capacitated to provide the services in terms of identifying the cases and what should be done. So when we realized that, we said, okay, we can take this on. We can provide the education that's needed. We can create, we can capacitate the service providers. These are the things that are in our reach that we can do. Training the nurses to know this is sickle cell, how should we handle it? It is possible. But also supporting the screening, like, okay, identifying the cases, it's also possible. So we said, okay, we can take this on.
This project is very unique in one way or the other, because it links the community to health facility and also link also the facility to the council health management teams. So compared to other projects, at the beginning, we found that there were a lot of denials. Children were being kept at home, denied access to services. But through the engagement of CHWs who are well connected to the community, they help us to at least create awareness, making sure that the community understand that there is availability of free of charge services.
The previous year, the World Sickle Cell Day was commemorated in Tabora. So they didn't have that. But back in their head, they knew that the prevalence of sickle cell in Tabora will be high. Why? Because of the tradition of the region. It's near to the lake zone where the prevalence is high, but also the integrated tradition, the Arabic traditions, the intermarriage traditions, and all of this stuff that are going on in Tabora. So they knew that this region must have a high prevalence, but they didn't have that. So the reason they sent us to Tabora is because we provided a strategy that could bring results. So we started with 17 facilities, primary health care. And then when we started the screening, that's where we noticed that the prevalence in Tabora is high.
The first thing that we took in consideration with regards to that was the ability to be able to reach in the remote areas. Because most of those areas, they don't have internet access. We went to do a manual manual workflow. So at first, when the project started, we did not start immediately with the system. We had to go and study the environment, study how they work, what other system do they have there currently, how do they report, and what will be more flexible, easy for them to use. They were actually had to prepare weekly manual reports, monthly manual reports, quarterly, and so forth.
So we had to put more energy into giving the education. So training the service providers in CHW, that was part of it. Making sure we have a group of people who knows sickle cell, who knows what needs to be done, and the importance of screening. So after screening, giving the results, some of them accept, some of them don't accept. So those who don't accept, majority are influenced by the tradition, the myth around the death of children in the villages or in the families. There are families that they will tell you like, this it's common in our family. We know. So we have to give birth as many children as we can because we know some of them will die. And then when you come back and tell them, no, it's not necessarily, it's not a must that they will die. You just don't have to put that mentality. This is a health condition, it's a medical issue, and it can be attended.
Being that it's being implemented at the facility level, I think it's easy for the government to implement and cooperate in terms of any other area that we may require them to chip in. It's easy for them rather than extended activities outside the facilities.
So the feedback was very good because we minimized their reports. The system generates all the reports that they were supposed to send, monthly, weekly, facility-wise reports, daily reports, everything the system does itself. All they have to do is to enter the information. So also in the system, we created the access. So the end users, they only enter information. They don't do nothing else. There is another level that deals with the reports, and there is a management level. So we secluded it into different segments so that it will not add more weight on the local people. So they actually happy about the system. They enjoy using it. That's why we get daily data. Like every day they must enter information because it is not more work to them. Rather, it simplifies what they will have to do at the end of the week or end of the month.
Most importantly, that it is possible for a sickle cell child to live long, continue with his or her educations, just live a normal life. That was the most important message, that it is possible. Getting them out of the tradition, getting them out of the long living myth around sickle cell, and then bringing them to the science world, that this is a medical condition and it can be attended. That was the biggest part that helped us to just bring these people together, getting to understand, seeing the importance of screening, and just bring the children to hospitals like we saw in the field. That was the best part that this had brought out. When it comes to service provision, CHW will come in the area of monitoring, following up. So after screening, this information will be disseminated to the CHW. So CHW will know how many sickle cell patients they have in their village of service. So currently, they're responsible for the dissemination of information on sickle cell, but also doing the follow-up. Keeping in mind that after screening, we have 9 months before the children start hydroxyurea. So it's most likely the parent will be a bit will lag behind on going for folic acid, PenV, or for any other clinic service that the children might need. But with CHW keeping tag of them, it will be easier for them to follow up, like, okay, how is that baby, how is that parent, how is that father, how is that mother, and so forth. So when the time comes for hydroxyurea, it will be easier to have all the information packed at once. But also, even in our daily follow-up, it's easy to reach out to CHW. Like right now, we can go into the system and say, in village X, we have, let's say, we identified 5 children with sickle cell. So it's easy to go straight to the CHW that in your village, you have 5 children with sickle cell. Can you just go visit them door to door, check out how they are doing, if they need anything, if they need any assistance, or if they missed maybe a clinic, or just go check out how are they doing. it's easier that way with the CHW rather than sending someone from Dar es Salaam to go to door to door. So the CHW plays a bigger role in the follow-up, but also later in the services that they can provide.